Can we do it?
What is the biggest health mistake most families make every day without realizing it? Can just three simple daily habits keep you away from many lifestyle diseases? Stay with us till the end because today's Doctor's Stay special is full of practical health advice that every parent, every student, and every family should hear. Hello everyone, Namaste. Welcome to another inspiring episode of J Connect podcast. First of all, I would like to wish Happy Doctor's Day to all the heroes who are protecting our lives. Today, we are honored to welcome Dr. O.V. Jaya Kumar, a highly respected healthcare leader and pediatric specialist with over 4 decades of experience in the medical field. He is the founder, mentor, and director of Jeevan Group of Hospitals and currently serves as the director of Medway JSP Hospital, Chengalpet. He also serves as the president of the Indian Medical Association, Chengalpet branch. Welcome, sir.
Thank you.
Shall we start?
Yes.
So, my first question is if every family could follow just 3 simple health habits, so even every single day, so what would you recommend to stay healthy and reduce hospitals visits?
Definitely, first comes the nutrition, good diet,
Okay,
and
sir.
absolutely 7 to 8 hours of good sleep. That is also very essential to make your vital organs take rest. Next thing is physical activity.
Okay.
Maybe some sports activity or elderly people, little walking, jogging, like that. You have to be physically active. These things will be very helpful in keeping any individual healthy.
तो जैसा सर बोल रहे हैं, अगर हम अच्छी नींद लेते हैं, अच्छा खाना खाते हैं और फिज़िकली एक्टिव रहते हैं तो ऑब्वियसली हमें हॉस्पिटल विज़िट हमारा कम हो जाएगा. तो चिल्ड्रेन टुडे स्पेंड मोर टाइम ऑन मोबाइल फ़ोन्स एंड लेस टाइम प्लेइंग आउटडोर्स. What practical advice would you give parents to keep their children physically and mentally healthy?
Yes, I fully understand your question. Of course, mobile phone, it's not a bad thing, but only thing parents have to be slightly judicious.
Yes.
They should know when children should have accessibility to the mobile phone. They should not become an addict to mobile phone. That is one thing. At the same time, through mobile phone, children's due to various data and information they get,
Yeah.
so they empower their knowledge.
Yes.
So it's that way it goes. And children, at the same time, we should encourage children for playing, particularly outside,
Yes.
playing and mingling with other children of their same age.
Yes. Sometimes what happens, like parents forget vaccination, they were not able to follow up. So is there any guideline they have to follow to go for regular vaccination?
Yes, definitely there is a guideline. Any standard hospital now at birth itself we give vaccination chart, age and what vaccination they should take.
Yes.
And certain hospital they also have good practice of sending messages also
Yes.
to remind them. But vaccination is every parent should understand. Vaccination is a birthright of every child.
Yes. Thank you, sir. It
Sure.
was very good information for all the parents. Nowadays, sir, even young adults are developing diabetes, high BP, obesity, and stress related to illness. What simple lifestyle changes can help prevent these problems for them?
One thing is food, because of late due to various reasons, most of them have the habit of taking outside food rather than cooked food, and food pattern of food also has changed from traditional food to slowly our generation or younger generation has moved to fast food.
Fast food, yes.
That is one reason it has to be corrected. As far as possible, it's always better to have cooked food at home, nutritious food. And stress is another factor which has got a major health hazard. That is why we are seeing heart arrest, cardiac arrest and other major illnesses also in the younger age group also nowadays. Previously it was not like that.
Not like that.
Due maybe the work pressure or maybe the financial pressure or business pressure, whatever may be, stress is not good for your health.
Yes.
That's why earlier itself I insisted a 7 or 8 hours good sleep is mandatory to maintain a good health.
Especially after COVID, this risk is more for cardiac arrest or
Yes, I fully agree with you.
yes.
But still, lot of researchers have to go on until we prove it scientifically.
Yes.
Yes.
So for prevention, basically we have to focus on nutrition and good sleep
Good
and
sleep.
physical
Yeah,
activity.
yes. As far as children are concerned, vaccination is main important because now we have vaccinations for almost many illnesses.
Yes.
Prevention is always better than cure.
You are right, sir. Thank you, sir.
Thank you.
Yes, sir. So every home should have a basic first aid kit. What essential medicines and medical items should every family keep it?
So as far as first aid kit is concerned, basically it has to be in such a way it addresses small injuries taking place at home, maybe particularly children, maybe plain saline, clean saline water, cotton, bandages. As far as medication is concerned, I don't advise any self-medication generally.
Okay.
But paracetamol tablet for adults and paracetamol syrup for children is handy because for fever, untime, many may not be accessible to a doctor or a hospital. So at that time, only paracetamol syrup at home should be a part of first aid kit.
Yes.
I don't advise any other medication
Yeah.
taking without a doctor's consultation.
And some kind if someone is feeling giddiness or some kind of we can say cardiac arrest or
Something
so immediately. So what we have to do immediately for that? If
See, immediately you have to just check whether they are conscious, well oriented.
yeah.
In case if they are conscious, okay, you can keep them in a very comfortable atmosphere, a comfortable situation, maybe switching on the AC and just wipe their face with
Water.
plain water.
Okay.
And at the earliest, it is better you reach the nearest hospital possible.
Okay.
If they are unconscious, one main thing, please don't give anything to drink. Because most of the people, what they do when unconscious, they try to give them water or anything.
Okay.
But that is a dangerous practice. It should be avoided. When the patient is not unconscious, just make them little comfortable with good temperature, like good air conditioning, and immediately make arrangements for shifting the patient.
Okay.
The patient is conscious, you can give little water sponging and some cold items to drink. Yes. See, due to global warming, year and year temperature, generally temperature is rising all over the world, particularly in our India also.
Yes.
The first step should be you have to keep yourself well hydrated. You have to take a lot of liquid diet, maybe plain water, porridge, or fruit juices, standard coconut water. You have to keep yourself hydrated. If possible, during peak day, particularly afternoon time, it's better to stay indoors as far as possible.
Yes.
And you have to avoid unnecessary travel during summer.
What message would you like to give to all the doctors?
My wishes to all the doctors on this Doctor's Day, and I am also proud to be a doctor thanks to my parents who have made me a doctor. And next, greatest happiness what I have is in the last 40 years of traveling in the healthcare. I have been instrumental in bringing a few healthcare facilities that has facilitated and for many younger doctors, they utilize their entry-level healthcare profession and they have grown up well. That is a satisfying thing for me. And with my organizations, almost 25 years plus, I have been supporting nearly 200 families. That is the greatest achievement. As far as I am concerned, I feel so.
Thank you so much for joining, sir. And it's my privilege that I got this chance to talk with you. Thank you so much, sir.
Thank you all.
Thank you so much.
Once again, happy Doctor's Day to all the doctors who dedicate their lives to caring for others.
Thank you so much for watching this episode. If you like this episode, please like, share and subscribe.
We will see you in the next episode. Stay healthy, stay informed, and keep smiling. Thank you.